Hello, my name is Janice Smith, and I'm the director of our outpatient retail pharmacies here at Loma Linda. Today I'd like to share with you a bit about some of the clinical programs that we have throughout our 5 retail pharmacies here at Loma Linda. Let me start with giving you a little background about who we are and what we do. Outside of the traditional dispensing role, we have clinical pharmacists that are trained to provide a variety of different services throughout our health system. One of the programs that they provide services to is our discharge medication program. This program consists of filling discharge prescriptions for patients and doing a complete medication reconciliation prior to the patient leaving the hospital. It also involves delivery of the medications to bedside and an extensive consultation where we can review the medications and address any questions that the patients might have prior to them leaving. Another area that we work with is our managed care department. Our managed care department, we have a collaborative practice agreement in place that allows us to do a complete medication reconciliation for the patients post-discharge. We also work with patients on statin and asthma medication compliance. And we also work with another health plan, Anthem, to provide blood pressure education and monitoring for their patients. In addition, we work with IEHP, Inland Empire Health Plan, to provide clinical services to a select population of high-risk patients. Why do we do this, and why do we extend and stretch ourselves to go beyond the traditional dispensing roles? Well, it's important for us to improve medication compliance for our patients, and providing discharge medications and addressing any challenges that patients may have with their maintenance medications allows us to do this more effectively. We also expedite discharge when we assist with addressing any potential problems, and we decrease readmissions for these patients. Improving patient satisfaction by making the discharge process much more smooth is also a result of our services. When it comes to quality measures, one measure, such as HEDIS, is measured by managed care department, in which we want to ensure patient compliance with medications. In the end, what we do is we make life easier for our providers and physicians, and also for our patients. We address insurance problems, take care of prior authorizations, and make sure that transportation and other access barriers are addressed. We find problems and fix them. Now, we need to be able to document these interventions that we take, and we do this through our electronic medical record system by recording events. We have medication reconciliation events, clinical issue resolution, access barriers such as cost, product availability, and transportation for the patients to get to their medications and pick them up, and also, of course, the patient consultation and education. This slide shows an example of the different types of interventions that we offer and how we record those and the numbers of those within this fiscal year. The highlighted interventions are the most common and potentially significant interventions. Discharge clinical issue resolution, following up on any insurance authorizations that would prohibit the patient from getting their medications, and also completing a medication reconciliation to ensure there are no duplicate or inappropriate therapies, and providing an extensive education to that patient about their medications and addressing any questions that they have prior to discharge. In addition to recording our interventions through events, we also review our capture rate. Our capture rates are important because the more prescriptions that we are able to fill and capture within our 5 retail pharmacies, the better opportunity we have to identify and address any challenges and barriers that these patients might otherwise have if they were going outside of our system to fill their medications. As you can see, from 2018 to 2021, At one of our campuses, East Campus Rehab Hospital, our capture rate from the time that we began this discharge meds program in 2018 was 46%, and in 2021, that had jumped to 82%. Once again, the importance of this is not just fiscal financial considerations for the pharmacy, but also can help us to provide opportunities to address issues that patients would otherwise have to address after they're discharged from the hospital. This slide also provides some additional information about another program that we offered on what was formerly our 7th floor at our hospital for the cardiology department. Once again, our capture rates were increased overall when we started providing the meds to beds, bedside delivery, and patient education at bedside. So what does the future hold? We are adding and actively working to add more discharge units and increase the size of our team to be able to help more patients throughout all of the campuses here at Loma Linda. We're also actively working with health plans to expand the clinical programs that we offer, which allow us to utilize and practice at the top of our skill level for our pharmacist team. We also are working to broaden our collaborative practice agreements with other providers throughout our healthcare system. Thank you.